Good evening, everyone. Let's talk COVID vaccination, shall we? My name is Stephen Moser. It's a pleasure to be here. I will be moderating, hosting this very interesting evening where we talk about various things all to do with COVID and its vaccination. But before we do anything, I'd like to thank One Vision for hosting this, and I'd like to hand over to the CEO, the founder, if you like, the powerhouse behind One Vision. So over to you, Enoch.
Thank you, Stephen, and thank you, everyone. One Vision is delighted to be hosting this COVID vaccine webinar. As many of you know, One Vision works closely with different communities and have a bigger understanding of different struggle these community faces. We have an excellent panel of medical and scientific professionals with us today, along with our own Public Health Director for Hertfordshire, Jim McManus. And we thank them for their time this evening and the life-saving work they do on a daily basis. You may have noticed that our panel is diverse, just like our community. And it is my prayer that we continue to be supportive of one another during these difficult times. That we continue to be inclusive and engage with everyone in our community, regardless of social or ethnic backgrounds. That we politely address one another and the different questions and concerns that our diverse community is asking. It is vitally crucial in this time of national health emergency that we stand together in solidarity with all in our community, including our wonderful, diverse communities. Let's work together to defeat this dreaded virus, which has caused so much pain, misery, and unfortunately death in our communities. May I wish you all strength and health, and soon that we will return to meeting and greeting one another in person. Thank you for joining us. We have an apology from Lord Lieutenant Robert Ross. He could not make it, but we have our High Sheriff, Henry Holland Hibbert, here with us, and Dean Russell, the Member of Parliament for Watford. We thank you for joining. In that note, I will hand over to Henry to say a few words before we start and hand over back to Stephen.
Thank you very much, Enoch, and it's a pleasure to join you this evening. I am not a scientist. I do not understand the technicalities of this vaccine, but all I can say, and all I believe very strongly, is that I feel that as a nation we have come together in the most fantastic way. The scientists, the technology, the universities, and all the people who have worked tirelessly to create these vaccines for us to use. We're leading the world in vaccinating our communities, and we should be extremely proud of the people who've developed the vaccine, and of course now the incredible medical staff who are doing so much to ensure the population receives the vaccination. I think it is outstanding how these people are working day and I believe also at night in some cases to get the vaccine rolled out. It is the hope which we need. It is the light at the end of the tunnel, and it will bring us through to the other side, and we will be able to return to our normal lives. But also, just to quickly say that I think that what you do with One Vision, your community spirit and the way you bring people together in Watford is also an outstanding achievement. I think it's a wonderful blessing to have you with us in Watford, and I think your approach to the whole community in our city, in our town, is outstanding, and I thank you very much for all the work you do to help so many people. It's a pleasure to join you this evening. Thank you very much.
Thank you very much. So let's kick off. Let's start with Professor Jim McManus. He's the Director of Public Health for Hertfordshire County Council. He's going to share some of the data with us. So over to you, Professor. Thank you so much.
Thank you, and good evening, everybody. I hope you can hear me all right. I'm going to try and share my screen and show you just a few slides. Now, I would say I've got many more slides in terms of much more material if people want it, and you'll be pleased to know I'm not going to use it this evening. I've just shared the wrong presentation. I do apologise. That's technology for you. Sorry, just a second. Hopefully, there we go. Hopefully you can all see that now. Can you all see that? Great, you can see it. Okay.
It's good. Thank you. Yep, go ahead.
Fantastic. So the roadmap out of has 5 essential things we need to do. First is the vaccine. The second is hygiene, and that's places as well as people, so buildings as well as individuals. The third is distance and reducing social interaction. The fourth is face coverings, and the fifth is test and self-isolate. We now have 3 vaccines, 2 already licensed, a third on the way, a fourth in development that we know reduce disease and death from COVID. In fact, they've reduced serious disease and death by over 85%. So the vaccines are making a difference. And this time last year, people were asking where the vaccine is. And here we are a year later with vaccines for the virus. And we face the issue of people asking now whether they're safe and asking questions. And I want to make a plea for as many people as possible to get the vaccine. And I'm going to speak specifically about Black, Asian and minority ethnic citizens tonight. We know that people who are Black, British, Asian or minority ethnic are much more likely to be vulnerable to COVID, not because of any biological reason, but because they are more likely to be exposed and for a series of other reasons, including structural inequalities and injustice. And my team did some work led by Kazim, who's one of our GP registrars in public health on this area. And I'm happy to share with you the report. It's in the public domain. But we know there's a variety of factors that predispose people who are Black, Asian and minority ethnic to COVID and to be vulnerable with COVID. And those include everything from the fact of income to the fact that people use public transport to a range of other things, including pre-existing diseases. And we also know that if you look at our ethnicity, Pakistani populations in Hertfordshire have been disproportionately affected in terms of COVID. The same with Black British and the same with Asian. So for 1 in 8 people in Hertfordshire have been affected by COVID. 1 in 5 Black, Asian and minority ethnic people in Hertfordshire have been affected by COVID. And Black people are more likely to die. They're more likely to get ill. Why? Well, it's simply not because of biology. It's because of a range of factors, including exposure. The incidence in our BAME communities in Hertfordshire is 7 times higher than those of white ethnicity, with Watford having the highest incidence. There's a whole range of factors, but this is something that we have to address. But the very populations that are most likely to be affected are the populations who are least likely to take up the vaccine. So among the general population, 82% of people are likely or very likely to take up a COVID vaccine, according to the Office for National Statistics. Among Black or Black British, 72% are unlikely to take up the vaccine, and among Pakistani and Bangladeshi, 42% are unlikely. This creates a big issue for us, and we must be very careful to avoid any blaming of populations for this. Because while we talk about hesitancy in vaccines, that can easily become a racist response that blames the people for not taking it up when people have legitimate questions about the vaccine and need answers. And if you look again at the national study, you'll see again from this diagram that the pink is people who are unlikely, that if you're black or black British or Asian British, you are less likely to take up the vaccine than if you are white British. And that presents us, I think, with an issue about addressing why people have legitimate questions. And I think we have to recognise that every single question anyone has about the vaccine needs to be treated at face value. If you look at Hertfordshire, our Indian population, 65% of them have had their first dose. That's really wonderful. 61% of white British have had their first dose. 47% of Pakistani and Bangladeshi, 43% of black and black British have had it, just to take an example. Now, while that is higher than other areas, so for example, in some parts of London, around a fifth of Bangladeshis have had the vaccine who are eligible. There is still a gap there, as you can see, between populations. And we have to do our level best to make sure that the vaccine is both accessible and acceptable to people. And I want to just suggest to you that there are 4 big issues in terms of barriers. The first set of barriers is structural barriers. So are we making sure that communications are in the right language, that they're culturally respectful, that the vaccine centres are in the right places, that people can get to them? That's a big set of issues. The second thing is the use of the word hesitancy. Now, we need to be careful about this word, because if we're not careful, it can blame people. But hesitancy is a range of things. Black women have a particularly strong cultural memory around what some doctors have done with vaccines in the past. You know, many people will remember Tuskegee and the way that the misuse of power against black people by health professionals. So others will have cultural and ethical issues and questions. We have to take these absolutely seriously and respect them. So we need to deal with people's questions in a way that people can feel that they have been given accurate, unbiased information about what is safe and effective. There's an issue about data as well, and there's also a massive issue about disinformation. There are 4 well tried and tested solutions. First is you build access and cultural sensitivity into the vaccine programme. The second is that you create confident communities who know the information and know the facts around vaccines. The third is you get really good data so that you can monitor who's not getting access to the vaccine. And the fourth is you combat disinformation by sharing accurate information together. And I want to make a plea. I'm not going to go through this slide, but there are 14 sets of work going on here already around Black, Asian and minority ethnic communities in Hertfordshire, a number of them in Watford. There is room for more. So how can the County Council help? Well, we can give you information toolkits. We can give you access to training on vaccine take-up and hesitancy, and we can also help with funding. Well, I want to make a plea to you to work together to do everything we can to protect the communities in Hertfordshire that are at most risk of death. You know, our residents who are most likely to be exposed to COVID and currently less likely to take up the vaccine. We have a lower gap in Hertfordshire than many other places, but actually I want that gap to narrow, and I'll finish on that message. And sorry for if I've overrun by a minute or two there.
Stephen, you're on mute.
Thank you so much, Jim. I'll get the hang of all these clicks and buttons. There's a lot of data out there, but I think the bottom line is that we are pushing hard to get these communities who are not keen on having the vaccination to understand why it would be beneficial to them. So just very quickly to say, questions are coming in. There are a lot of questions coming in, but we will save them to the end of our presentation, and then we will address them. So if we can go straight on now to Dr. Sukhtev Singh. Now, Dr. Singh is a GP who is also a specialist COVID advisor to the Sikh community. He's been working a lot with COVID vaccinations, and I shall hand over to you, Dr. Singh. Thank you very much.
Thank you, Steve, and good evening to everyone. I'll try and stick to time, but you know, doctor sometimes cannot stop talking, so I've got a few little notes in front of me to keep me on time. Firstly, I just wanted to make it clear that vaccine hesitancy is not a new issue. Most of you may have recalled the MMR and autism, again, where there was not a strong link, but it created havoc and it created unnecessary avoidable deaths. And unfortunately, this time around, the pandemic has created the ideal conditions for mistrust in a vaccine. And I will go through that in a couple of minutes. So it all started off with a novel virus in December. And we, even as doctors and scientists, knew nothing about this new virus. It didn't have a name. We didn't know what it was going to do or what the symptoms were, but we had an idea that it was really quite a problem because of the deaths that were occurring in China. So everything seemed to be guesswork, and that was not a good start. And by January the 10th, we actually knew the genomic sequence of this virus. By February the 20th, it was given a name, SARS-CoV-2. And by March, we were in a pandemic and lockdown. So within 3 months of total confusion, not knowing anything apart from the name of the virus, we are all globally held hostage by this huge killer that is a once in a century pandemic. We have about 6 or 7 viral pandemics per century, and SARS and MERS in the last 10 years or 15 years are prime examples. Now, the long-term nature of the pandemic has meant we've had multiple lockdowns and various tiers restricting all of us. So now the public are not even confident in the government's response or even in the very large institutions like the World Health Organization. We all hear, and I think all of you know, that the pandemic has really stressed our societal structures and the way we view human values, and discrimination has become rife. You know, everyone started saying it was the Chinese, and poor Chinese people were being attacked violently on the tube and various other places. And let's not forget, all of these things remain in people's memories, but subliminally, and all add to poor confidence or hesitancy. And as Professor McManus said, let's not call it hesitancy. It's more low confidence in the vaccine. So vaccine confidence is something we need to build. And poor confidence in the vaccine has implications for us all. Now, I'm just going to focus on the misinformation side, because there is also the other big problem of anti-vaxxers. Anti-vaxxers are those strange people who don't believe that COVID exists, despite everything happening around them, with multiple research evidence, deaths, every country not really working in a very sort of a favorable way. But there are several themes that have led to this hesitancy. And the first, as I said earlier, was the origin of the virus, connected to a wet market in Wuhan. Some coined the term the Wuhan virus. And then Donald Trump made things worse by calling it the Chinese virus, even made a jibe and called it Kung Flu. All racist comments, and this did not help the way that a medical serious issue should be viewed. And then we had false and misleading statistics, some countries underreporting and hiding what was happening for various fears, and then variances in what the World Health Organization was saying and what other experts were saying. The impact on society, I'll just very quickly mention panic buying. I only have to say toilet rolls and hand gel, and you all know what I mean. And people won't forget empty shelves, again, for no real reason. Nothing was going to run out, but fear and panic is what people do when this type of pandemic occurs. Politicization, I've already mentioned the Trump damage and how Trump and others used and abused politics, just like the Brazilian lead. And again, using a pandemic for political reasons is not going to give you a good outcome. It's going to create poor confidence and the public that really do not know what's going on. And there was discrediting of news journalists and good news. And then from about February, I remember I was doing quite a few programs on Sikh channels and Punjab radio and various other sort of local community channels. And the commonest questions were these fake medical cures, majority emanating from India, for example, such as drinking cow urine was going to be a cure. And people literally were not preventing and doing all those useful measures. They were doing things of no significance. Drinking hot water, cough 10 times and the virus doesn't enter your body. And then Trump made his biggest blunder by talking about swallowing ultraviolet lamps and drinking disinfectant. There's been fraudulent financial gain. People have had their data stolen. People have been made to pay for test and trace without knowing, and the same for vaccines. And then came along what we were all waiting for, which was the rapid development and licensing of the vaccine. And there's some very good reasons why it took 10 months. And there were no shortcuts taken. So we have a fully robust, highly effective, safe vaccine. But if we have time, we can talk about why it was 10 months and not the usual 4 years. And then a whole host of other misinformation. There was the 5G masks, there was monkey virus, there were fetal cells, there was plasma in the vaccine, there's Bill Gates and his microchips. And of course, the Black community, who will not forget the impact of slavery, when they were subject to experimental drugs and all types of discrimination. And I was really shocked to read this week how even in India, they've done something very similar to the slum residents in Bombay and Delhi, where they didn't know they were being tested or not experimented, but part of trials. They were just given vaccines and not told what the actual implications are. So this unfortunately happens in large countries that are not really as well controlled, as tight as they should be. And Professor McMahon has talked about the variation in vaccine uptake, where young people are really not keen. Women are less keen than men. The low-income deprived groups are not really trusting it. The Black community have a very low take-up. All of this is something that we need to tackle head on. And I think instead of reinforcing and focusing on each of these, we need to pull out of that and show the benefits of the vaccine to date that did not show up in trials. I mean, today, figures are over 20 million vaccines have been given with no real new side effects that were shown in the regional trials. The first vaccine is giving something like 76% protection from going to hospital and dying. And that is a huge impact from the first vaccine. 2 doses of the vaccine give you almost 100% chance of not going to hospital and dying. And the added bonus that we're now seeing from the huge use, the multi-million use all over the world, is that vaccines are also reducing transmission. And there are 2 issues. One is protecting yourself from disease, and we need 75 to 80% herd immunity to allow that to happen. But the second is transmission. And transmission really is the big issue that we've tried to stop with prevention. So let's focus on the real evidence-based, data-driven, clear messages that are coming out loud and clear from every country on this is how good the vaccine is. I was very pleased to see that there's a difference in the actual uptake of the vaccine. And in January, there was a survey asking people their opinions. That was before the vaccine was given. And now there's real data on real uptake. And there is a huge increase across the board in everyone taking the vaccine. So my last point is going to be, the vaccine is our one and only ticket this year to get out of the pandemic, for us to then spend all that energy and effort to get back and finding the new normality. Just as we had to find a new normality after 9/11 and life was never the same, We are going to have a new normality post-COVID. Let's not wait for a new cure, a medicine at the end of next year, because guess what? Everyone will not trust that new medicine, just like they don't trust this vaccine. So I hope I haven't taken too much time, Steve. Thank you.
Thank you very much, Dr. Singh. Thank you, Sukhtev. We will, as I said before, address any questions, and questions are coming in at the end once we've done the talks. So I will go straight on to handing the time to Dr. Diamantopoulou, who is the interventional clinical lead and radiologist at Guy's and St. Thomas's Hospital, a colleague of mine, my boss, in fact. Over to you, Thanasi. Thank you very much.
Thank you, Stephen. Thanks, everybody. I think this is a great opportunity to share some in a very simple way, a few data, and I try to give to the community some information about the vaccines. So, and especially speaking to such a diverse community, it's always a pleasure. And from my side, I will try to highlight a few things about what was the decision and why we have changed in the UK, why in England we have changed or we have approached the vaccine program in a slightly different way. So I don't know if you can see my slides. Perfect. So at the moment, we do have 3 different vaccines that they have been approved for use in the United Kingdom. We have the Pfizer vaccine, for the people who have heard about it, which was the first one, was approved on the 2nd of December. We have the vaccines from the AstraZeneca, which is the Oxford vaccine for in a brief, which has been approved at the end of December. And more recently, at the beginning of January, we have the Moderna vaccine. We had a very similar technology in how it is working with the Pfizer vaccine, but it has not been at the moment quite rolled out in the vaccination center. So the main 2 vaccines are the Pfizer vaccine, which was the first one which was approved, and is called an mRNA vaccine, and there will be other speakers who will give more details about that later, I hope. And the AstraZeneca vaccine, which is a different technique similar to some of the older versions vaccines. So according to the manufacturers, these vaccines have specific, and I know there is a lot of debate about how they should be used and what should be the schedule for these vaccines. According to the manufacturers, the AstraZeneca vaccine has a specific indication to be given in 2 doses with a minimum of 20 days, almost 4 weeks apart, one dose from the other. But the second dose, according again, as I said, to the manufacturer and the data we have from the studies, can be given up to 12 weeks after the first dose. There are some scientific evidence, some data, as we call it in medicine, that they support that even if the vaccine is actually delayed, it may have better outcome and better protection in the individual people. But this is specifically for the AstraZeneca vaccines. And this had been debated quite a lot at the beginning, but now that we have more overview on the data and the available trials and the studies, we do have the knowledge that actually the vaccine seems to be more effective if it is delayed up to close to 12 weeks. The difference is the Pfizer vaccine, the first one that has been approved worldwide, which is an mRNA vaccine. And this has, according to the manufacturer again, had been given an indication that the second dose should be given 20 days apart from the first one. In the UK, it was decided, because of the operational reasons, that this vaccine, will also be given in intervals between 4 and 12 weeks. It doesn't mean that neither of these vaccines will be given in 12 weeks, but it will be given in intervals between. And I can tell you for a fact that my wife, for example, she had offered the second dose of the vaccine in 8 weeks or 9 weeks. It's not necessary that it will go up to 12 weeks. This is a general recommendation. Now, as I mentioned already, the first vaccine, the AstraZeneca vaccine, it can easily be delayed according to the indications up to 12 weeks. However, about the second vaccine, the first one that was approved, the Pfizer one, the opinions are quite different, and they are different between the scientific community. So about this specifically second one, and I will not speak a lot about the AstraZeneca vaccine, but more about the Pfizer vaccine, which has a 3 weeks interval as recommended. The questions that most people in the communities have is, will I be protected from just having one dose of the vaccine and while waiting for my second dose? And the second is the indication why this operation was decided to delay the second dose of the vaccine was to allow more people to benefit from the protection provided from the first dose during the rollout phase. And that means that it will potentially, people thought, the science thought that that way will have a great impact in reducing the death rates, the mortality, and will reduce the severe disease, and will reduce the hospitalization and the pressure in the hospitals as we know it. Now, the question again, as I said, I will try to very briefly and very, very simply try to answer these questions. So the first question was, will I be protected from just having one dose of the vaccine? Well, we do have good indications from the data that we as doctors and the science read, that from the trials that they have been used to in order to approve these vaccines, that even a single dose of the Pfizer coronavirus vaccine has been able to cut the numbers of disease and serious disease specifically. A more recent trial that was actually published during the last 3 or 4 days has mentioned that a single dose of the vaccine reduces the number of asymptomatic infections. That means that people who get infected, but they don't have symptoms, and that way it can significantly reduce the risk of transmission. It also reduces, it is also indicated in that trial that actually only a single dose of the vaccine after 2 weeks, after 12 days, it can reduce and protect from COVID-19 to 75%. That means it will protect 75 out of the 100 of people who will have the vaccine, which is an exceptionally high number if you consider that other vaccines like the flu may have around 50 or 60% in some years of protection. So this is a very highly number, and it's the way I present it to my parents, to my family, to my relatives, is that actually 75% is definitely better than 0%. And I will insist on that. Now, a more recent trial has also showed that a single dose of both of the vaccines has resulted in reduction in the risk of COVID-related hospitalization in Scotland. And this is data from this country. And we know now that either vaccine, whichever vaccine you have, you will reduce your risk of going to the hospital and potentially getting seriously ill by at least 85%. So as a conclusion, yes, both vaccines protect, and the available data we have suggests that there is protection even with one dose. One dose, in my opinion, is better than none. And it's, in simple terms, some protection is better than no protection. And this is what I've said to my family and my relatives. So thank you. And I will just finish with this one, Steve, that this is from the BBC News just 46 minutes ago. I just copied it into the presentation just now, is that a single shot of either the Oxford AstraZeneca vaccine or the Pfizer vaccine reduces the chance of needing a hospital treatment, a serious disease, by more than 80%. So 8 out of 10 people will not have to go to the hospital because of COVID if they get vaccinated, even with one single dose. Thank you very much.
Thank you very much, Thanasi. I can see people leaving our conference by the droves now, rushing in to get their first vaccine. So thank you so much for that. Let's move on now. We've got Afroza Ahmed. Dr. Ahmed is a GP, a mindfulness coach, a tutor at university, but she is going to deal with COVID and the risk to the BAME communities. So over to you, Af. Thank you.
Hello, I'm Dr. Irfan Ahmed, and I'm delighted to be talking to you about COVID and the risk to BAME communities. First of all, I'll just tell you a little bit about myself. So I'm a GP, I'm a medical doctor by day, and I also do some university teaching and a school governor locally in London. I've also written some books, and my other interest is mindfulness. I'm a mindfulness life coach. So before we get started, I thought it would be useful to actually define what is BAME. We hear this term bandied around a lot in the press and the media. It actually stands for Black, Asian and Minority Ethnic, and is defined as all ethnic groups except white ethnic groups. It does not relate to a country of origin as such. You might also have heard other abbreviations such as BME, which stands for Black and Minority Ethnic, and BEM, which stands for Black and Ethnic Minority. Now, it's quite a broad term, and some people are not happy with it entirely because it's about lumping groups of people together who might not have anything in common. However, it did come from a good place. It was first used to promote diversity and inclusion in the workplace and to promote efforts to decrease racism and discrimination. So I think for the purposes of this talk, it is quite useful. So in relation to COVID, does this matter? Well, yes, there's a lot of frightening data out there which tells us it matters a lot. There's a disproportionate impact of COVID-19 on Black, Asian and minority ethnic people. This has become very clear. For example, Black people have a 4-fold higher risk of dying than their white counterparts. White people have a lower risk of death in all ethnic groups apart from Chinese. For females, the highest rate was among those of Black Caribbean, and 35% of patients in intensive care were non-white. And when we talk about COVID, we should also talk about mental health and well-being, which is my speciality and interest. And it's really important to highlight that in this pandemic, mental health has affected more of those in the BAME groups. In fact, research from the Office of National Statistics UK showed that 27% of people from Black backgrounds found it difficult to make financial ends meet, compared to about 10% among the white groups. That led to a lot of worry in these communities. Most people from Black, Asian and minority ethnic groups also worked in poorly paid jobs, leading them to be most worried and concerned about their household finances. And we know when people have concerns and worries, it does affect their mental health, their well-being and their physical health. Once the government lockdown took hold, people from these groups were more likely to work longer hours and less likely to be employed and eligible to be furloughed than their white counterparts. Data also showed that those in the Indian ethnic group reported greater difficulty in going to sleep just because they were worried so much. However, whatever your background, whatever your ethnicity, this pandemic has definitely affected everybody's mental health. Now, when there was another poll commissioned by the Royal Society of Public Health, and that revealed that 3 in 4, 76% of the UK public would take the COVID vaccine if advised by their GP, which is great because it shows that there's trust in the public in the NHS professionals. I think it also highlights that most people are more than happy to get a vaccine, provided they get it from the right source and a trustworthy source. However, speaking of the BAME community, there were findings that 57% from those in these groups were less likely to accept a vaccine compared to 79% of white respondents. Confidence was actually the lowest among those of Asian ethnicity, of whom 55% said they were likely to take it. However, there is good news. BAME respondents who were not willing to be vaccinated were especially receptive to offers of further help and information from their GP. Over 1/3, 35%, said they would likely change their minds and get the jab if they were given more information by their GP about how effective it was. And I think as a doctor, we need to be listening to this kind of information. It's really encouraging from us. It means it can be fixed. So talks like these will help those numbers go up, the confidence go up, because there are 2 main reasons why people are not wanting to have the vaccine. One is a genuine worry that they're worried about the side effects, and that's natural and understandable when something's new. So talks like this will help. The other one is misinformation. That's a little bit more tricky. Now, when we talk about misinformation, we naturally talk about social media. Gordon Hull, US Secretary of State, said in 1948, a lie will gallop halfway around the world before the truth has time to pull its breeches on. There was a time, and that was a time there was no social media, no smartphones, no tweets, Facebooks or Twitter. Now there's been an explosion of misinformation and disinformation spreading like wildfire in social media, including WhatsApps and messages. In 2020, a lie will circle the world countless times before the truth has a chance to come out. And as a doctor, not only are we battling the virus in the GP centres and the hospitals, we're also battling the misinformation that's going on. Take the 5G conspiracy theory, for example. This resulted in actual physical destruction of mobile towers across the globe. The workers who worked for telco were subject to verbal and physical abuse. In Birmingham, one of the 5G masts that was providing services to a COVID-19 hospital was damaged, and this meant that patients couldn't communicate with their families. It's interesting because there was an investigation by the Australian broadcasting company which traced back that the 5G conspiracy all started with a tweet in January 19, and a week later it was spread by a right-wing conspiracy group, and that really boosted the claims, and then the rest is history. So my advice is, whatever information you get from whatever one, even if it's a close loved one and a friend you trust, always try and look for something yourself. Anyone can quote a fact, anyone can get an expert, anyone can grab a headline and use it to fuel a theory. We know for a fact that people from BAME communities are really affected by this virus and their outcome is worse. If there's one message I would like to leave you with is look out for information about COVID or vaccine or anything you're worried about from a trustworthy source. So you can go to the NHS website, the gov.uk website, your GP, your health professional, rather than follow what's being bandied around social media, even if it's done hundreds and hundreds of rounds.
Stephen, you're on.
I'm not getting the hang of this. My apologies. Let me try that again. Thank you so much, Dr. Ahmed. There is so much information and misinformation flying around there. I get emails all the time from people sending me these various quotes, links. To be honest, I've stopped replying. And perhaps that is one of the problems. If we who are medics, doctors in positions of responsibility and respect get this kind of information, it behoves us to respond to them. So now let's move on to Dr. Irfan Ahmed. He is a consultant at Guy's and St. Thomas's Hospital, and he's going to speak to us about some of the side effects that you might encounter after you have the vaccination. So Dr. Ahmed, thank you.
Hi, this is Dr. Irfan Ahmed. I'm one of the consultant interventional radiologists. I work at Guy's and St. Thomas's Hospital. Really, the purpose of my short talk today is to explain what to expect after your COVID vaccination. I think one of the problems with social media is that there's a lot of misinformation and outright lies being circulated amongst various groups with really false information of what the side effects and risks are of having COVID vaccination. So hopefully I'll be able to dispel some of those. First thing to say is that COVID vaccines do cause side effects in roughly around a third of all people who have the vaccine. These side effects are generally very minor and short-lived, and it's important to remember that actually not everyone gets any side effects. So some people have vaccine and have no side effects at all. So if you get side effects, it's nothing to worry about. It means your body is mounting an immune response. And this is actually why in younger people, sometimes we see that they actually have more side effects than in the elderly population. In terms of side effects, we now know a lot more than we did perhaps back in December when the vaccine program was starting, although even at that point there had been over 40,000 people who'd taken part in trials. Now we have a situation where we've got almost 20 million people in the UK alone who've had the vaccine. So we're learning a lot more about what the side effects are. The most common, by and large, is a painful sore arm, which can last usually 1 or 2 days after the vaccine. This is very common and settles by itself. Other side effects are sort of what you would call mild flu-like symptoms. So you may feel a bit tired, you may have a slight headache. Some people feel a bit sick or nauseous, and general aches and pains and, flu-like symptoms is what many people do experience, often worse after the second dose, actually. Now, uncommonly, some people also do experience some swelling of their lymph nodes, perhaps in their neck or in their axilla and other areas. This is nothing to worry about, and again, it is an uncommon side effect, but it again settles by itself. If at any point, remember that you have any symptoms that are getting worse and you feel you need some advice, you can always ring 111 or speak to your GP, but rest assured, vast majority of people, their symptoms will improve after a couple of days. What about the so-called false information or fake news that's being spread about vaccines globally, really, primarily through people who are, perhaps have an agenda or are particularly anti-vaccines as a whole. So some of the fake side effects you may have heard of is that the Pfizer vaccine, which is a mRNA vaccine, it can alter your DNA permanently. Now, of course, we know this is absolute nonsense and flies in the face of what science we know, because mRNA vaccines, what they do is they do enter the cells and they cause the cells to produce a spike protein, which is presented on the cell membrane, and then the body mounts an immune response against it. But they do not enter the nucleus where the DNA of a cell is present. So this is impossible and a total nonsense. Other fake side effects, and I in fact read recently an article about this, is that there's some news circulating that vaccines can make you infertile. Again, totally untrue. And in fact, many of the women who did go on to have who had the vaccine in the trial did go on to get pregnant, and there's absolutely zero evidence that it causes any problems with fertility. What about paralysis? So in the trial, there were small numbers of patients who did develop some temporary facial paralysis, very, very small numbers, by the way, which resolved by themselves. It's called Bell's palsy. But actually, now that the numbers have been vaccinated much, much more, it's been found that actually there's no causal relationship between the vaccine and developing Bell's palsy. So again, not true and fake news, I would say. Likewise, any suggestion of a vaccine causing brain damage is utterly nonsense as well. Allergies are obviously quite topical. Back in December, when a couple of healthcare workers developed what you could call a severe allergy to the vaccine, which was treated and they didn't die. And as I say, with any medication, you can develop an allergic reaction, whether it's a paracetamol or any tablet you take. So it's not surprising that there are people who develop allergic reactions to vaccines. But again, the numbers are very, very small. And at present, the guidance is that unless you're allergic to the previous dose, so you may be ready for your second dose, but if you had an allergic reaction to the first dose, or if you're allergic to any of the known ingredients of the vaccine, then it's utterly safe. It's completely safe to have your vaccine, and you needn't worry. And just remember also that where you are having these vaccines, there are trained medical staff there who can deal with an allergic reaction, and most of these reactions happen within the first few minutes after the vaccine, which is why the guidance is that you stay in the practice where you've had the vaccine for around 15 minutes or so, just in case you are one of the very rare people who develops an allergy to the vaccine. There are some common questions that people often also pose us healthcare workers. For example, people have asked, can you catch COVID from the vaccine? Obviously, the answer is no, because the vaccine does not contain a live virus. So it's impossible that you get COVID-19 from the vaccine. If you don't have the vaccine, on the other hand, you are very likely you can get COVID-19. So again, false information is spread about this. It's impossible to get COVID from the vaccine. In terms of going back to your normal activities, yes, you can go back to your normal activities. You may get some arm pain, as I mentioned. You may feel a bit flu-like for a couple of days, but if that's not guaranteed, and if you actually don't have any symptoms, there's nothing to stop you from going on to do whatever you need to do. Finally, are you protected after you've had the vaccine? I guess some people are keen to know if they can go back to normal once they've had the vaccine. Now, again, important to remember that for your body to develop an immune response, it can take up to 2 weeks. And even then, the protection has been stated as being between 80 to 90%, or even up to 95%, depending on which vaccine you've had. So there's no guarantee that you are 100% protected after you've had the vaccine. So actually the recommendation is you continue to practice social distancing, take precautions with your friends and family, and remember to wash your hands and all the regular guidance that we've given to all patients since the start of the pandemic. That's all from me. Thank you. And if you have any questions, I'd be happy to take them now.
At the end, Irfan, thank you very much. What did I have? After I had the vaccine, I'll tell you, I was exhausted the next day. I'm not convinced I can put it down to the vaccine, though. My busy household with 5 kids exhausts me pretty much every day. Let's move on now to Magdalena Jarzabek, another consultant who is based at Guy's and St. Thomas Hospital. She's going to speak to us about COVID and some of the concerns in relation to pregnancy. Magda, thank you.
Good evening, everyone. My name is Magdalena Jarzabek, and I work at Guy's and St. Thomas Hospital as Interventional Radiology Consultant. Witam szanownych Państwa, nazywam się Magdalena Jarząbek i pracuję w szpitalu Guy's i St. Thomas w Londynie. Mam przyjemność przedstawić krótką prezentację na temat problemów w ciąży związanych z zakażeniem wirusem COVID-19. I was asked today, and I have a pleasure to give a small talk for the community about concerns related to pregnancy and COVID-19 infection. What do we know and how dangerous is COVID-19 in pregnancy? According to the NHS England recommendations, pregnant women are the group of moderate risk patients for COVID-19 infection, which means there is increased chance of catching the virus by pregnant women compared to non-pregnant population. It is known that the virus may be passed to unborn baby in mother's womb. Newborn babies, however, are known to get better after infection, and severe illness is known to be very, very rare. As the coronavirus pandemic is new to humans, we partially rely on the information from other infections, like, for example, flu. And we know that the flu infection is more common in pregnancy due to decrease in the mother's immune system to protect the baby. We know that there is slightly more risk to develop blood clots in pregnancy, which appears to be also a problem in COVID-positive patients. This is why a combination of these two factors, having COVID and being pregnant, potentially doubles the risk of having blood clot in the system. How do we know there is more risk while being pregnant? There are very recent studies which showed 16% increased risk for pregnant patients to develop serious illness during COVID-19 infection. According to initial studies, the risk of death is reported to be 13.6 times higher compared to non-pregnant patients. And there seems also that there is slightly increased risk for gestational hypertension and preeclampsia in patients with positive PCR tests. And these conditions are present while in normal pregnancy. However, with COVID infection, the risk is even greater. On the background of the current medical data, there is no concerns about safety in pregnancy claimed by the regulatory body across US, Europe, and Canada. According to the medical knowledge, there is no evidence for significant side effects in pregnancy after vaccination, which are different from non-pregnant population. There is no living virus in the vaccine, in the COVID vaccine, that can be passed to the baby. However, the vaccine is still under investigation and there are no current large studies on the population of pregnant women. The recommendations vary in different countries. At the moment, in the UK, as standard practice is to not recommend routinely vaccine to pregnant women unless they are high-risk patients. The reason for this is current lack of studies and extra precaution. However, you can decide for yourself, given the fact that you know the potential risks of COVID infection, if you would like to go ahead with vaccination. There are ongoing trials in pregnancy and some groups of high-risk patients are already vaccinated, like healthcare workers, for example in US, and women who didn't know that they are pregnant and who had the vaccination. There is no medical evidence for the risk of miscarriage after vaccination or infertility. So everyone has to decide for themselves if they believe in the studies and investigations conducted so far, even if they are limited. NHS England and United States of America, as well as World Health Organization recommendation states that vaccination is safe to be given during breastfeeding, and the virus is not passing into the breast milk. Take-home messages for pregnant women during COVID-19 pandemic would be to take general recommended precautions like clean your hands, maintain social distancing, wear face covering, keep up with your pregnancy appointments as either on the phone or virtual as advised. Discuss your concerns with a midwife or GP, and consider vaccination if you are high risk in pregnancy or have the vaccine after delivery. Thank you very much for your attention.
Thank you so much, Magda. Let's move straight on to Anita Parthipun, who is a consultant, who also a consultant radiologist, but who also does a lot of work in pediatrics. So what are the concerns about COVID when it comes to children? Anita, thank you.
Good evening, everyone. My name is Dr. Anita Parthipan, and I'm a consultant at Guy's and St Thomas's NHS Trust, but I also work at Evelina Children's Hospital. Evelina Children's Hospital is one of the largest paediatric hospitals in the UK, and it's the second largest paediatric hospital in London. It's located adjacent to St Thomas's Hospital and is situated opposite the House of Parliament. So coronavirus can be considered as a cousin of the flu and the common cold virus. It has managed to spread worldwide due to the ease of global travel. Fortunately, children have not been affected as much as the adult population. If they do catch the coronavirus, they often develop much milder symptoms compared to the adult population. However, a very small percentage of children may require hospital admission. Back in March 2020 and April 2020, as the number of coronavirus adult cases in the UK was slowly tapering down towards the end of April, we noticed something strange and different in children. Between 1 to 5 children in every 100,000 needed admission to hospital for COVID-19, and even fewer of these required intensive care admissions. We started noticing a small number of children and teenagers who developed a rare inflammatory condition which appeared to be linked to the virus, but this unusually was occurring 4 to 6 weeks after they had COVID-19. So what do you do as a doctor in this situation? You pick up the phone and you ring colleagues within the trust and also in other hospitals to see whether they were also seeing children with similar symptoms. And interestingly, we then realised that our North Thames region colleagues were also seeing the same thing. So now you had pretty much all of London having these little cluster of cases. And so we felt that we needed to do something. And so at Evelina, they described the first series of a cluster of children with these symptoms. And this was published back in May last year in 2020. And the Evelina gave this cluster of cases a name. And the short title is PIMS-TS. And it's a hyperinflammatory state seen in children who have had exposure to COVID-19. It's rare and it occurs in less than 0.5% of children who have had or have COVID-19. Most children with the condition will not be seriously affected, but a very small number of cases it can be serious. So what is PIMS-TS? Inflammation in general is a normal response of the body's immune system to fight infection. But sometimes the immune system can go into an overdrive and begin to attack the body. If this happens, it's important that children receive urgent medical attention. In children with PIMS-TS, the inflammation can affect the blood vessels, particularly those around the heart. But one good thing is that it can be treated. All children with TS have a fever which persists over several days. There's a very wide range of other symptoms that children might have, and this includes tummy pain, diarrhea, vomiting, rash, cold hands and feet, and red eyes. These symptoms can be found with other illnesses too. While most won't be seriously unwell, some children can be seriously affected by the syndrome. The most important thing is to remember that any child who is seriously unwell needs to be treated quickly, whatever the illness. So I'm often asked, how many children have been affected? Well, that's a difficult question to answer, and that's because as a group, doctors in general are still in the process of reporting back, and also because there isn't a definitive test for PIMS-TS itself. However, between April and June 2020, doctors reported seeing around 200 children with the condition. We're now hopefully past or going through the tail end of the second wave of COVID-19, and we're expecting to see some more cases of PIMS over the next few weeks as the number of cases of COVID-19 remains high. Another question I often get asked is, are Black or Asian children more likely to be affected? Well, the answer to that is that children from all ethnic minority backgrounds have been affected by PIMS-TS. There have been more children affected by PIMS who are from Black and Asian backgrounds, but it's not clear what the reasons for this are at the current time. It is possible that this is because there are higher numbers of COVID cases in these communities. But it's important for families with all ethnic backgrounds to be aware of the signs and symptoms of this condition, however rare. So what's my take-home message for you? If your child has a temperature of 38 or higher, cold hands and feet, and is sleepy, call your GP or 111. If the symptoms persist and you have not been able to speak to either your GP or 111, take your child to the nearest A&E. If your child doesn't have any of these signs of being seriously unwell, but you are still concerned, talk to your GP. Well, I hope you found that talk interesting and informative, and thank you for listening.
Thank you so much, Anita. Very useful and very scary. Hard to believe that 0.5% of our children who catch this could get this very, very serious hyperinflammatory condition. But just to round things up a little, we have had all of the talks, and while these talks have been going on, I have barely been able to keep up with the questions. So I'm going to lump some of these questions together. So one of the questions that has been recurring is, what are these vaccinations made of? Is it vegan? Is it vegetarian? Does it have pork? Does it have fetal material? Does it have material from cows? What's in them? Could I pass that to you, Jim? Jim, just unmute. Thank you.
Sorry, I thought I told you I wasn't very good with Teams.
I'm so relieved that somebody else did that.
Right. I said, so the short answer is that the British Vegan Society issued a statement saying that they considered these vaccines to be acceptable for vegans. There isn't pig products in them, and nor are there fetal cells in them. So one of the vaccines was studied using cell lines which had originally been taken from a fetus, and we're talking decades ago. But you'll find that both the British Islamic Medical Association and most Christian medical associations, the Catholic Medical Association, have all said these vaccines are ethically acceptable. Have I answered the question, Steve? Otherwise I'll go on all day.
No, you have. No, that's absolutely fine. Has the Jewish community spoken on this as well?
Yes, so I think there have been several statements from different sections of the Jewish community. One of the things is that would consider themselves more traditional from all faiths have made comments about this, but certainly most Jewish, the word denomination isn't right, but actually a number of Jewish scholars have said this is fine. And I know the chief rabbi, last time I looked, had encouraged people to take the vaccine up. So for those affiliated to the United Synagogue, there is that encouragement.
Thank you. So another question which has come up, but has been partially, in fact, if not totally, answered during the talk is the issue of infertility. But the point is, the question has been raised about infertility with both men and women. Maybe just before that, if we could go to Sukhtev, because I think you want to say something.
Just to say that there are two large organisations in the UK. One is made up of all the doctors' associations. So we've got the Sikh Doctors Associations, of which there are three. There's a BIMA, the Birmingham British Islamic Medical Association. There's Jewish doctors, and there's about 15 other groups on this BAME network. We have all ticked off the vaccines as safe, and for vegetarians, halal, kosher, no issues at all. And there are no animal products at all. There's also another group that's been set up on the NHS called the NHS REAG, the Religion and Equality Advisory Group. And I'm on that as well, and we've also approved that. So just to say that all the doctors' bodies, after having consulted their own faith bodies, have said that these vaccines are absolutely fine. The Pfizer one, for example, is a synthetic protein. It's a man-made protein. There's nothing in there of any animal at all.
Good. Okay, thank you. So the question about female infertility has been, I believe, answered. Does anybody have a comment on male infertility, the contribution to this vaccine on male infertility? I will tell you that many people who've had the disease have had effects far worse. So having the disease can affect almost every aspect of life. But does anybody have a comment about the vaccine and male infertility?
Steve, could I just pop in there again? So
yeah,
there is a coronavirus yellow card scheme, which basically is a surveillance system which picks up all the side effects that you may get after a vaccine. And when the AstraZeneca trial on 23,000 was done and the Pfizer on 44,000, they came up with data that actually has been confirmed with 20 million real cases. And we're now up to 20.6 million. There is nothing new with any new side effect, and certainly no infertility in men or women. In fact, medically speaking, there is no way that vaccine could actually cause infertility. It doesn't even get into that system. Remember, the Pfizer mRNA has to be stored at minus 70 degrees because the mRNA protein breaks down within 2 or 3 hours. And the mRNA is a bit like a letter. You post a letter into the person and it gives a message and then it's gone. And that's the end of that mRNA. And the AstraZeneca uses the viral vector, a vector being like a postman, to post that letter. So both of them ultimately rely on mRNA. And once they're in the body, they go nowhere near the fertility side. And if I tried to make up that it could affect it, I couldn't even work out any physiological process that would link the vaccine to fertility. So there is absolutely no link.
Steve, I would just add that I think the confusion maybe has arisen because there was a study in the Lancet which showed that the sperm counts were lower if you have actually had COVID-19. So actually, if you suffer with COVID, your sperm count has been shown to be reduced. But I think that, as usual, with social media, confusion reigns, and that people are confusing the fact that if you get COVID, your sperm count in males reduces, whereas if you get the vaccine, there's absolutely zero evidence that your sperm count reduces.
Yeah, thank you. Yeah, so that's the point. Without the vaccine, you do far worse than with the vaccine, and that includes infertility. So now I'm going to, I've got another question here, and that is about people who are on various medications, be they blood thinning medicines, medicines which are immunosuppressing them, indeed patients who are on anti-cancer treatments. What is the advice for them? Now, the first thing I will say about that is get advice from your GP or from your oncologist. But are there general points of advice that are that we can share on this forum? Any hands? I'm going to start picking on you guys. Thanasi.
The only thing I want to say about that is that in all the vaccination centers, there are doctors that they attend the process. And if there are any concerns about specific medical conditions, they will be there to answer those questions. And they're there to make you feel safe and secure during the whole process. Also, because of the initial concerns with 2 or 3 out of millions of doses of vaccines that have been given of allergic reactions, there are also concerns that people are staying there for 10-15 minutes after the vaccination in order to make sure that everything is safe. But there are no safe concerns about that. I only want to say, and that's why I've raised my hand, that the group of patients that you are describing with cancer and immunosuppressed and all that stuff, they're actually the group of patients, the group of people that they are in biggest danger if they ever get COVID. So the vaccine is not contraindicated for them. It's actually, they are in the priority groups in order to get the vaccine, in order to get their treatments and continue going to the hospitals and attending their other treatments. Because what we must not forget is that there has been, throughout this whole pandemic, there have been a lot of people who have delayed or have been reluctant to go to the hospitals for other treatments. And the vaccine is, in a way, I don't want to sound that, I don't want this to be taken in the wrong, but it's a ticket to be able to feel more secure to go back to the hospitals and have their treatments as appropriate. That's the only thing I want to comment about that. I hope that helps.
Yeah, thank you. Yeah, so that is the point. If you are in these groups, you're much more likely, it's not that you're more likely to catch it, but if you do catch it, you're more likely to get killed by it or certainly have a very serious illness. So thank you very much, Thanasi. Now, another question that's been coming up about this RNA, DNA, so the question that's coming up and has come up a few times, number one, is this manipulating our DNA and does this have consequences in the long term? Number one. And number two, this happens so quickly. Now, vaccines normally take a long time. This happens so quickly and suddenly they're rolling it out to have it used on the Black community, the Asian community, before the white community gets it. Now, some might say that they smell a rat. Does somebody want to address this? Jim, please.
Can I do the second bit first? And I've managed to unmute myself this time, haven't I? Which is good. So
well done.
So the first thing is, it hasn't been rolled out to the Black community before the white community. It's been rolled out to people who are at most risk of death, which is people in care homes first. The second thing is, this time last year, we were all saying, when will we get a vaccine? And now we've got a vaccine, we're saying, well, how's it come so quickly? And there is an element of we can't be satisfied. I just want to kind of leave that out there. And the answer we've got it so quickly is because I think it was Sukhtev who said at the beginning, within a matter of weeks, we had sequenced, I think it was by February, we had sequenced the genome of the virus. And that enabled us then to actually look synthetically at what types of vaccine would work. So we'd sequenced the virus within a matter of weeks. We already had vaccine technology developing both for years for all types of vaccines, including the Pfizer mRNA vaccine, which was developed for cancer, and then we applied it. So I guess that would be the message I would say about the vaccine. They didn't cut corners, they simply concertinaed time. And normally when you develop a vaccine, it takes a good 10 years for the simple reason that you finish one stage before you go on to another, because it costs about £500 million to develop a vaccine. And what they did here was they put it all together. So I think that will be the way forward for vaccines in the future, and we've benefited from it. That would be the least of my worries about a vaccine.
Thank you. And any comments on it manipulating our DNA? Anyone?
Yes, Steve, could I just add to what Jim
Please.
said? We had MERS and SARS. SARS, again, a respiratory illness, a severe acute respiratory illness, and MERS, Middle Eastern respiratory. That was in 2003 and then 2008 to 2012. And research did start on both of those illnesses because both were almost a pandemic, although one only created less than 800 deaths globally. So there was some research that had started that was now picked up by the companies. So there's already work in progress. Number two, as Jim has said, all of the companies collaborated together to find the genomic sequence. Normally it's done behind closed doors because everyone's competing to get the first drug and get the profits. This time, everyone's working together to save the globe and to save virtually everyone from avoidable deaths. The third is governments put a huge amount of money into research and development, which is an added benefit. So you can see all the things being put into the process helped to speed it up. Number four, the one thing normally that slows down a drug's development is the trial, where you're looking for a patient with that disease. And if you're developing a vaccine for a disease that is pretty infrequent, you might have to wait 2 years, 3 years to recruit all your patients. But guess what, with COVID-19, there were millions and millions of patients around, and the uptake to recruit to trials was so quick and larger than most vaccines that we had, within days, if not a week, we had all the people needed for the AstraZeneca, 23,000 and 44,000 for Pfizer. So yes, as Jim said in summary, no shortcuts, everything was done more robustly. And in fact, as you know, as life progresses, everything is regulated and licensed even tighter than ever. I would say vaccines of old may have had issues in the way that they were developed, possibly even ethically. But today, you would not get a license if you tried to make aspirin a drug. It would not get a license. That's how clean the system is. And coming to your second question of, what was the second part, Steve, that you wanted an answer to?
The DNA.
Oh, the DNA, right. So going back to biology days, there's a nucleus in the cell where the DNA sits. And the mRNA is not going to affect the DNA. The mRNA goes into the cell, stays outside the nucleus, and it goes to a protein generating part of the cell, which starts manufacturing this protein, which is the antigen, which is the spike type of protein. That is then thrown out of the cell, and then your antibodies and T cells come along and create an immune response. So it's a bit like someone posting a lecture to your house. It's not going to change your Encyclopedia Britannica. That's on the shelf. It might change you and the way you view a particular product, but something that's miles away, insulated and out of the reach, it can't get to that.
Thank you very much. So I think the answer is no.
The answer's clear no.
Af, over to you.
Hi, I just wanted to break it down really simply, this idea that the vaccines were created so quickly. When I'm at home and I tell my patients this, and I'm cooking dinner and I'm doing it on my own, it takes a long time. When the boys help and my husband helps, we're really, really quick. And that's what we have with the vaccines, is that all countries around the world. They've put money into this, they've put effort into this, and it really is that simple. There's no conspiracy theory here. So just to break it down simple with that analogy.
Thank you very much. So Anita, putting you on the spot here, but there are two questions. Number one, are our children, if they get the first question is, will our children be getting vaccinated? And number two, are they then likely to get autism or variants? Over to you, Anita.
At the moment, there's no real plan to vaccinate children, and that's because when children are less likely to get COVID-19, there was a study by UCL, so University College London, back in May last year, and that looked at 6,000 studies that have been conducted so far. And the conclusion was that children are half as likely to get it compared to the adult cohort. And children, when they do get it, clinically, we've all seen it, get much less severe symptoms compared to adult cohorts. So I don't think there's any intention at the moment to vaccinate children, just purely because they are not as affected as the adult cohort. So that's the first one. And what was the second question, Stephen?
The autism bit.
The autism, I mean, it hasn't, I think there's a lot of anxiety with vaccination and autism, and that was because of the MMR vaccination. And that was based on very poor and almost inaccurate data about MMR and the link with autism. And I think lots of medics and lots of people in research have acknowledged that. So there isn't a link per se with autism and the vaccination, but there's very little data about it, to be honest.
Thanasi, do you want to speak on this as well, just very quickly?
And just very quickly, sorry, there are a few recent developments about that, Anita, actually. There have been some studies that they started recruiting children and looking at the data about what is if it's absolutely safe to be, for the vaccines to be given to children. And actually, Dr. Fauci in United States stated today, or yesterday, that they're planning, if those studies go ahead, to start vaccinating children before autumn, with a view to vaccinate much bigger cohort of children by next year, at this time next year. So the plan in the United States, at least, is for the children between 16 and 12 to be vaccinated during autumn, if the studies show that there are no problems, or they fine-tune the doses, and then followed up by smaller groups and smaller ages of children. There will be, that's the current plan. And just to say something about autism, because I'm really sorry, I'm very, how can I say that? I'm trying to be polite here, but there is no evidence that any vaccine ever in the literature has been connected or linked with autism. This is an urban legend that has been supported by a small group of anti-vaccinators, and it's absolutely wrong. I cannot emphasize more than that. There have been a recent meta-analysis, which is a group of, it's a study that brings data from a large cohorts of other studies, including more than 500,000 of children vaccinated and followed up, and there has been no connection with any vaccine ever about autism.
Thank you. So we're rapidly running out of time. Two very quick questions over here, which have been repeating. Should I, if offered the vaccine, should I take it? Will I need the vaccine if I have already had COVID? Yes or no? Somebody.
Yes, because
I'm going to say yes.
Yes, because there's a good reason behind this. The COVID illness itself may give you some antibody response, but at this stage, we don't know how long those antibodies last. Whereas the vaccine gives you a boost, that there are adjuncts in the vaccine which boost your immune response and therefore give you a much longer level of immune memory. So if you've had a COVID illness, some research, smaller research projects are showing you get an even better level of immunity for longer because your body's already been partially primed. Now, you can pick up COVID after a vaccine in the first 21 days because you haven't quite developed that protection. So there have been people who had a vaccine and in 7 days, because they lowered their guard and they didn't keep on a mask and they didn't do the usual, they picked COVID up from somebody else. So you can actually develop COVID in the early days after a vaccine, which is an entirely different issue.
Thank you. Magda?
And just a quick recommendation from the World Health Organization. So they advise, as we speak, to have the vaccine even after COVID infection. It may be delayed by a couple of months as we speak. And actually, the new findings are that even potentially after first dose and the first and after infection, previous infection, the efficacy and protection is increased when you have first the virus and then the first dose of the vaccination.
Thank you, Magda. Thanasi, please.
Very quickly, I just want to say that in the UK, the current guidance is to have the vaccine after you had the COVID. If you had COVID infection, you can have the vaccine after 4 weeks, 3 to 4 weeks. And just to say something for the audience there, I had COVID and I had my vaccine after 4 weeks. I had no problems.
Final question, just because we've run out of time, there are many more. Once I have the vaccine, can I go abroad on holiday? And I'm going to give that question to Irfan. Over to you, Irfan, unmute.
Thanks. I don't know why you've selected me other than obviously I do fancy a holiday at this stage.
Because we've been speaking about it at work, Irfan. We need a holiday. Well, not you and me together. But actually, even that would be great. But yeah, over to you.
Well, I think that perhaps our MP can answer that better than me, but there's no plans at the moment for vaccine passports. That's the latest I've heard in the news. It'll certainly make it safer for you to go on holiday. That's about all I can say really on that question, Steve.
And Thanasi, and then we're going to round up in a moment.
Because I have a personal interest again, of course, and I want to go for holidays and I want to see my family back in Greece. The European Union is actually pushing for the vaccine passport at the moment, and they're in discussions on how this will be done. And I'm more than certain that this will come in the next few months. And I believe probably, yes, as Irfan suggested, our MP can comment on that in more details. But I was reading some reports as well that there will be potentially a vaccine passport, but not only, just to highlight something, it will not be only for the people who had the vaccine. So it will not be selective for that. It will not be a way to force people. It will be also be used for people who had the COVID or have antibodies or have tests. It will be just a more generic way to confirm in a way that you have some kind of immunity against COVID. And I was reading that potentially there may be thoughts of using the NHS app to do that, something similar here, but I will stop there because I'm not expert. So our MP can comment on that in more detail.
And we will come to that in just a moment. Dean, all the pressure is going to be on you very shortly. You're going to give us the way out to holidaying all over the world, and we are so looking forward to it. And if you let us down, oh well. Out at the next election. No, sorry, this was not supposed to be political. My apologies. Now, let me remind all of you of something. I come from an Asian background, and in many Asian households, you will find that the last word is had by your parents. Over to you, Mum and Dad.
Good evening. My name is Dr. Eric Moser.
And my name is Dr. Susan Moser.
Between us, we have been practicing medicine for over 100 years.
And we have seen many diseases like typhoid, cholera, tetanus, diphtheria,
tuberculosis, HIV/AIDS, polio, and now we are living through a pandemic of COVID-19.
Forgot to tell you that we have seen smallpox, which many of you, I don't think, have seen. And there was a family who lost 4 children.
We have had our vaccination, and this has protected us from COVID-19.
We hope the rest of whoever is listening to this will also have the vaccinations and thus protect yourself, your family, and the community. Thank you.
Thanks, Ma. Thanks, Dad. And all that remains is for me to say thank you to our participants. Thank you to Enoch. And thank you to all of you who are listening. But now I will hand over to Dean Russell, who is our MP, our Member of Parliament, and who is also on the Health and Social Care Select Committee. Thank you so much, Dean. Over to you.
Well, can I just say a huge thank you to all of you, to Enoch for organising this with the team, to Steve for being an amazing host. Over the past year on the Health and Social Care Select Committee, I've been very fortunate to ask many of the questions that have come up tonight to Professor Whitty and Sir Patrick Vallance, and be able to do that through the committee, and along with being on the Joint Committee for Human Rights. And what we've seen over the year is a tremendous effort across the country to get vaccines in place. And what I've seen over the past few months as a volunteer, I've been volunteering at Watford General Hospital for the past year, and more recently been very fortunate to volunteer as a vaccination volunteer. And what I've seen is the huge relief on the staff of NHS workers' faces as they have had the vaccine, to see the relief of people over their 80s and 90s as I've visited other vaccination centres. And what I would say is, from tonight, hopefully for people who've got questions, valid questions and concerns, hopefully tonight will have assured you that, you know, much of the myths that are online around the vaccine are untrue. And that you've seen medical professionals give very candid answers around the issues we face, especially for the BAME community, but also more broadly as a society. And I think when we look at the vaccine, as was said earlier, a year ago, we were calling out for this. And within a year, we've had a vaccine come to the fore that now has been put into 20 million people have had a vaccine. I mean, that's an incredible figure. And within Watford, 20% of the population has had a vaccine. And that's really down to the work that all of you have done on here, to incredible workers and NHS staff and social care staff, and right through to of course, the scientists who developed this. So what I would say to anybody who's concerned about having the vaccine, who's heard tonight and still has questions, ask those questions, go to .gov.uk, speak to medical professionals. Don't listen to what perhaps is being shared on WhatsApp or on social media from people who may want to scare you or provide misinformation. The information is all there, from the fact that, as was mentioned earlier, around the fact that there's no animal products in this, right through to concerns around fertility and so on. The reality is, the more of us who have this vaccine, the safer we'll be in society, the quicker we can come out of lockdown, and things like going on holiday again, as was mentioned earlier, will be so much more possible. But it's on us all to, check what we're doing, take the vaccine, and make sure that you're keeping yourself safe and others. And finally, what I would say on this point is that what we're seeing through the evidence has been spoken about today. Increasingly, we're finding the evidence is not just that it will protect yourself, but actually is reducing transmission. So there's a great need, even more of a greater need, to take the vaccine if you get the opportunity, and to protect you and others. So all I would say is thank you to every single expert that has spoken tonight, but also to all of you who are watching both this live, and hopefully I'm sure there'll be a recording of this available too, because you're right to always ask questions, and you're right to ask politicians questions. And I appreciate the phrase, trust me, I'm a politician, doesn't always work in circumstances. But the reality is this is a medical approach. It's a medically driven approach. And the science behind this to keep you safe, to save lives and get us out of this lockdown. So thank you all for listening. Thank you for asking questions. Thank you for responding to those questions tonight. And I look forward in the months to come, as we come out of lockdown because of this vaccine, to see you all in person, and for us all to be able to give our grandparents and our parents, as Stephen's parents were brilliant just now, to be able to give them a hug again. So please take the vaccine and look out for the accurate advice that's out there. Thank you.
Thank you so much. Thank you, Dean. So that was Dean Russell, our MP. Now, Enoch, this is just the start and not the finish. I don't mean the meeting, but what we're intending to do. So over to you, Enoch, and then we will hand over to Harjit Singh, who is Chair of Trustees, to round it up. Enoch.
Thank you, Stephen. Thank you for hosting this. Stephen not only hosted this, so quickly he put together this program for Watford. Watford, Three Rivers, beyond Hertfordshire, we are so lucky to have 9 consultants, senior GPs here who cares about others. And they are dedicated to do this. However, today we are very lucky and we are very proud of, on behalf of Watford community, we would like to say thank you. I'm sure that Harjit will catch up. Stephen Moser, he not only works in the hospital looking after the patients, after 12 hours, 13-hour shifts, he comes and cooks for One Vision community. And he has cooked amazing meals, 200, 300 meals per day. And thank you, Stephen, for your continuous support. And he's also a hero of Hertfordshire, given by our High Sheriff and Lord Lieutenant. Thank you, and continue to do your job. You rightly said, what is our next step? One Vision brings people together. And I always say, this is an action group. Well, we will continue to do this webinar very often throughout this year. And also, our next step is we will be working very shortly, very soon, I'm talking about weeks, 1 or 2 weeks, we will be putting pop-up vaccination center in Stamborough Park. We have almost signed, working with different faith groups, and also not only Stamborough Park, we'll be working with other faith and different community areas. So we encourage you to come into our vaccination center. We're working very closely with Jim, Dean, and the High Sheriff, and all the NHS people. And this is because we want to make it easy for you. We are here to help you. And please look out for the vaccination center closer to your home, closer to where you live, closer to where you worship, closer to where you gather. So you'll be comforted and you can hold hands with us. And I will see you soon in our vaccination center. What we're going to create is called a pop-up, little marquee to vaccinate you all. Thank you.
Thank you, Enoch. Harjit, our Chair of Trustees, please. Thank you very much. And a good evening from me.
Stephen, I just want to extend my thanks from the Board of Trustees on One Vision. I think today everyone can appreciate the holistic approach that's been given here by all the professionals and the close relationship that we have with Jim. And a big thank you to Jim as well, because I know he's been on quite a few webinars, but he's taken his time out, again, just like the rest of the professionals that we see in front of us. And Steve, I do want to say thank you, because the speed that this webinar is being sort of created and people brought together, you know, it's impressive. I think we had a conversation and literally on that evening, we had people coming to bringing this program together. So a big thank you, Dean. As usual, you're on our Board of Trustees as well. A real appreciation to all your support that you give. But I think one thing we can see, there is a light at the end of the tunnel. But for that light of the tunnel to be grabbed, and you know, for the next couple of months, we all need to take our responsibilities very seriously. Just like Steve's actually had his mum and dad on this webinar, I think it's important that we speak to our parents as well, because sometimes the information that we might receive is different from our older generations, how they are receiving the information. And for us to actually speak to them and combat that other information that's being given out, like the other doctors said, it might be from WhatsApp information or just conversation or TV programs from abroad that don't have that understanding the way we do. Please speak to your doctors or professionals, get in touch. If you need our assistance, and if there's communities out there that do need our assistance as One Vision, we're there for the community. And there's lots of programs that we're going to be leading upon. Next week, we've also got International Women's Day as well. And beyond that, there's other events that can be taking place. So we're quite busy. And the people that you see here, people like Enoch, people like Michael, people like Steve, Dean, it's good to see that hands-on approach as well. We're not just people that sit back behind a screen. We are an organization that are hands-on in each individual, takes their responsibility very serious. So I just want to say finally a big thank you to everyone that's turned up today, all the support that you guys have given, and hopefully we can continue to take this forward. So thank you very much, everyone, and a good evening.